We take in roughly 25,000 breaths per day, and nearly 80% of people do it wrong. Let's dive in. Welcome to a Healthy Control podcast, providing education to create a healthy, balanced lifestyle, empowering you to take control of your health and not let health take control of you. It is wild that something we do in the first moments of being on this earth, so many of us are doing incorrectly. Did you even know that there's actually a proper way to breathe? We're going to focus on the correct way to breathe and the most prevalent incorrect way. That way we can fix it. Now, there are other breathing dysfunctional patterns such as orthopnea. That's where you can't breathe very well laying on your back. There's also like Cheyne-Stokes, agonal breathing, hyperventilation, and many other, more medical diagnosis ways of breathing. And those are far beyond the scope of this podcast here. But for today, we're going to focus on your normal everyday breathing and why it matters, why it can lead to anxiety, why it can cause more body pain, and decrease athletic performance, and of course, how to fix it. Let's start off here. If you're in a good place, follow along with me. We're going to do a little exercise. So you're going to place one hand on your upper chest and one hand on your belly and breathe. Just breathe. I want you to exist for a few moments. Breathing. Let's just take some normal breaths in and out. No big breaths yet, just normal, everyday breaths. I want you to observe how much the hand on your belly moves and how much the hand on your chest is moving. Now I want you to take a big breath. And how did your hands change that time? How did they move? All right, you can stop breathing with your hands on. Keep breathing. Just move your hands away. Let's talk about normal breathing first. What is it like for you? Did your belly move? Did your chest move? Did they both move? If it's your chest that's moving, it's the hand that was on your chest that moved, we got some issues to work through. See, the muscle that's responsible for our breathing is our diaphragm, which sits on the bottom of our rib cage, so not really at the top of the chest. That's what brings the air in. Now, what brings the air out? Nothing. It's just the release or the escape of air. And when we breathe out normally, there's no muscles that actually activate. Now, if we breathe out forcefully, blowing candles or something of that nature, okay, that actually takes some muscles. But just everyday normal breathing out, no muscles. So we should be what's called a belly breather. That's where, as it sounds, we're breathing through our belly. There's actually a whole slew of consequences that can arise from not being a belly breather, which we're going to get into. But if you're a chest breather, if your chest is going up and down, we use about 9 muscles. 9 accessory muscles are going to kick in to help be a chest breather. Can you imagine at work, instead of just you answering an email, it was actually 9 of your colleagues trying to answer your emails? Not even you, just 9 other people answering your emails. How inefficient would that be? My goodness, that would just drive me nuts because that's not their job. And when we use these muscles, these 9 accessory muscles, they get overused, they get tightened, and they can actually cause headaches. They can cause back pain. They can cause shoulder pain. They can cause a lot of different pains because they're doing something that's not really their job. It can also produce anxiety from not being able to really get a full breath and having that tightness in your chest from those muscles being overworked because they're being overworked and they're becoming tight, so then you feel that tightness. Now, this is a very different feeling from chest pain, which could be related to a cardiovascular event, so always get that checked out. And when these non-accessory muscles are trying to kick in, it's far less energy efficient, which can cause you to actually become more tired throughout the day because you're not supposed to work that way. So that one thing that you're doing pretty much every moment of your life can cause you to be tired. Let's fix that. Who would have thought that just breathing could be the reason you don't have enough energy? But it's not too late to fix your breathing pattern. And we're going to go through a few breathing dysfunctions, and then we're going to get to how to fix them. Remember what you are, though. Are you a belly or a chest breather? Because there's another category to look at, and that is mouth versus nose breathing. And this is a super interesting debate, and Whew, did I go down a rabbit hole on this one? So let's talk about, we have mouth and nose breathers, but we also have doing it while you're exercising and then just your everyday breathing. So everyday life, almost always, we should be breathing through our nose. And there's many reasons for this. First of all, the air we breathe is dirty. And if you're a homeowner and you change that air filter every couple months or, I do every 3 months. I don't know if that's actually correct or not. Anyways, you can see how disgusting that thing gets, especially if you, like me, every once in a while do every 4 to 7 months or whatever it could be. By the way, a reminder on your phone is a great way to make sure you do it as often as you should. Anyways, some people don't have a filter from their brain to their mouth. Well, no one has a filter from their mouth to their lungs. But we all have a filter from our nose to our lungs. And not only that, it'll actually humidify and warm that air before it gets down into our lungs. Especially on a cold day, that cold air can cause bronchospasms, which is a contraction of the airways, essentially giving you kind of like an asthma attack. And if that wasn't enough, we can intake more oxygen through our nose than we can through our mouth. And there was a research study that looked at this and aimed to determine the effect of mouth breathing on hypoxia, or low oxygen in the blood. Blood O2 is usually like 98% or above. The study looked at it and determined that anything below 95 was hypoxic. If you have like COPD or even like during COVID, you could see like upper 80s, but usually 98 to 100 is normal for blood O2. So out of these 300 people that this study looked at, which relatively small study, but nonetheless, 65% had O2 levels at or below 95%. That is a crazy amount of people who did not have the normal amount of oxygen in their blood, and presumably because they were mouth breathers. And it does get crazy because mouth breathing from a different study determined that it can change your facial structure as an adolescent. They said that breathing through your mouth can cause your jaw to move backwards and rotate forward and produce an overjet, which is essentially buck teeth, and can increase your jaw angle and a narrowing of both upper and lower arches of canines and first molars. I'm not a dentist, but it's going to adjust how your jaw and mouth are shaped. And then also you get a posterior crossbite is more frequent. And also a posterior crossbite is more frequent. And also a posterior crossbite is more frequent, which I believe that's when your top molars are behind your bottom ones instead of in front of. All of that just because you breathed through your nose. All that because you were breathing through your mouth and not your nose. Plus, you're probably sick more because of the dirty air and you had less oxygen in you and all that other stuff. So this led me to wonder, should we ever breathe through our mouths? Let's get into that after the break. In through your nose, out through your mouth. That's the common advice for breathing while exercising or running generally. In regards to exercise, you may want to perform like a Valsalva maneuver for heavier weights, which you hold your breath and brace your core. For light running, sometimes nose breathing is better, and sometimes mouth breathing and nose breathing is recommended. Now, they say mouth and nose breathing because if you're breathing through your mouth, you're probably also breathing through your nose at the same time. It's pretty hard to shut the nose off. So I'm just going to call it mouth breathing, but it is technically mouth and nose breathing. So this next study had participants on a Wingate bike testing their anaerobic capacity. Anaerobic is that quick energy before you need oxygen, which would be aerobic capacity. So between nasal and mouth breathers, there's no difference in power output. At higher intensities, heart rate was higher for nasal breathing, indicating more stress on the system than it was for mouth breathers. Meanwhile, lower intensity exercise had no difference with respect to heart rate response between mouth and nose breathing. So from that, it sounds like at high intensities, it may be more appropriate to breathe through your mouth. But most of the day in other situations, we're trying to breathe through our nose as much as we can. And this study made me wonder that is our heart rate higher with nose breathing because we're not getting in enough oxygen? Your mouth is much bigger than your nose is. So when you breathe through your mouth and your nose, clearly you're going to get more oxygen just your nose. So is that the reason why, or is there something else? And can we train nose breathing to become more efficient? So I was reading a post from Marathon Handbook, which I'll put a link down in the description, which if you know me, I don't run marathons or hardly at all. So kind of ironic I was there. It's kind of out of my realm a little bit. But anyways, the author, her name's Amber. She's a certified personal trainer, running coach, and has a master in exercise science. And her recommendation is to slow your running pace so you can breathe solely through your nose. From there, you're going to pick up the pace until you hit a point that she calls air hunger. So kind of that point where you're like, I really need that big breath now. And you're going to hold your intensity or your running pace as long as you can at that area. And she said what this does, it helps desensitize your body to that air hunger feeling. It helps to train the ability to breathe better through your nose. So deep sea divers kind of do something similar. You know, those people who go down diving without any oxygen or whatever. And they're able to hold their breath for minutes, lots of minutes. And the reason is they have desensitized their body into, they can kind of get past that point of, oh crap, I need to breathe. They're able to keep their heart rate calm and they can get through it. So desensitizing your body into not thinking or realizing you need more air is a good way could be a good practice. Now there's other things you can do that help catch your breath. One of them is actually bending over at the waist and putting your hands on your knees. Yeah, that exact position that you probably try to do all through growing up and all your coaches told you to stand tall. So the reason this position is actually helpful is because it helps relax your torso and your thorax. That way you can breathe easier. You're taking some of the stress of your core off of your body for a second to allow you to breathe. And there's some other little tricks and tips that you can do to help with your breathing. Other things you can do to help your breathing. So in the beginning, we tested chest or belly breather in a sitting position, maybe standing. I'm sitting. If we lay on our backs, this is the least demanding position. This is the lowest physiological position. So laying down and then kneeling and then standing. So standing was going to take more core effort than laying down will. So if you're having trouble diaphragmatic breathing or belly breathing, go into a supine or laying on your back position and just breathe and focus on breathing through your belly. This is going to be step one. One routine you can do is to breathe in through your nose for about 3 seconds, hold it for just a brief pause, then exhale for 4 to 6 seconds, and then take 2 to 3 seconds between pausing and breathing again. So after a couple minutes of the diaphragmatic breathing on your back, try it in kneeling position and then standing and see if there's any difference. And you might find that you can do it in maybe supine and kneeling, but not necessarily standing. So that's just a progression to work on. There's another exercise called crocodile breathing, and this involves laying on your stomach with your hands under your forehead. Here you're going to breathe in through your nose for 3 seconds, hold it for a brief pause, and then exhale for 4 to 6 seconds. Wait 2 to 3 more seconds before taking in your next breath. And when you do the crocodile breathing, you want to feel the air go into your belly and actually expand 360 degrees around your torso. So your stomach, your sides, and your low back are all expanding as you breathe. This is a great warm-up into learning how to properly brace your core, especially if you're going to do something heavy like squats and deadlifts. Because when we brace our core, we're taking in a big breath and then we're actually squeezing out with our core muscles versus squeezing in. And that big breath should surround you 360 degrees. And I find a lot of people only breathe in through their belly and then they will crunch their core in. So, little quick tip, if you want to properly brace for a heavy lift, breathe in 360. You can try to place your hands around your midsection and back. I like to do like thumbs on my sides, fingers on my back. Feel the air go all the way around and then push out with my muscles. Also, when you brace your core, I want you to breathe in through your nose until you can't anymore, and then through your mouth. You will get significantly more air into your lungs that way and create a better tension through your torso than if you tried mouth first and then nose. Just give it a try. Fill your lungs up as much as you can with your mouth, and you'll probably be able to get nothing left with your nose versus if you do it the other way. Sometimes we have difficulty breathing and we just don't realize it. Or maybe we're a habitual mouth breather and we just don't realize it. This is when something as simple as a Post-it note at your workstation can just remind you nose breathe or belly breathe. That way throughout the day you occasionally see this bright pink Post-it note and it catches your eye and you can kind of reset yourself. And you realize over time you're doing it better and better, more and more. Another thing, and this is great for sleeping and even for exercise, is a nasal strip. And these help by opening your nasal cavities. And these can also help stop snoring because you'll be nose breathing more, mouth breathing less, snoring even less. Now, nasal strips don't work for everybody, but it's a super simple test to see if they can help you. And that's to just place your fingers on the side of your nostrils, put down a little pressure, and then pull them out towards your ears. This is going to essentially mimic what the nasal strip will do and open up that nasal passageway. And if you feel like you can breathe easier after doing this, nasal strips may help you. And personally, I've been using them for a couple years now, and they definitely help me sleep. They help my sleep quality, and they help me breathe just overall better. Now, finally, last tip here, I didn't even think of until I was reading about it, is your tongue placement. First of all, with your mouth closed, your teeth should never touch. Your top teeth and your bottom teeth should never be touching. Secondly, the tip of your tongue should be touching the roof of your mouth. This can actually help create a seal on your lips to keep them closed, forcing you to breathe through your nose and not your mouth. So remember, the proper way to breathe for most scenarios, especially just normal daily living, is in through your nose and your belly. Thank you for listening to A Healthy Control podcast. You can find us at YouTube at A Healthy Control and make sure to subscribe. You can also reach me at ahealthycontrol@gmail.com with any comments or questions you'd like answered on the show. Reminder, A Healthy Control podcast is for entertainment purposes only and not in lieu of any medical advice. If you have any concerns about your health, please speak to your healthcare provider.